Next up, we have Andrea Dillon from University of Adelaide Medical School, and I'll bring her on now, so see you soon, Andrea. And while Andrea is coming on, just again reminding that if you have any questions for the presenters at any time, you can use the Q&A feature. And as you saw, hopefully you can be having comments or making comments on those and upvoting them. So if you have any questions for Andrea during a presentation, that's the place to put them. So Andrea, I'll hand over to you. Cheers.
Thank you, Liam. I hope it's all good to go and you can see my slides. Good, okay, excellent. Good morning, everyone. Thank you very much to Liam and the ADI team for providing me with an opportunity to present today. My name's Dr. Andrea Dillon and I'm a senior lecturer and also the program coordinator for Year 1 to 3 of the medical program at the University of Adelaide. As my title suggests, I'd just like to talk to you today about our experience of using LT to guide case-based learning in Year 1 to 3 of the medical program in a particularly challenging environment this year. Just really briefly, our MBBS program is a 6-year undergraduate program, which means that our students are generally 18 to 20 years of age when they commence the program. The first 3 years are largely theory-based and case-based learning plays a pivotal role there. So the students attend case-based learning for 1.5 hours 3 times a week. They also have clinical practice, and in Year 3 they start to enter the hospital environment. Year 4 to 6, however, is much more hospital-based with just a little bit of component of university-based teaching. Now, in our pre-COVID world, the way case-based learning used to run was that the students had a monitor in their tutorial rooms, and they had PDF handouts of the information, so the presenting complaint of a patient, and they had various prompts, and a tutor helped guide them through the information. We had a person on a whiteboard who was recording all the group's thoughts and ideas, and then we had someone on a laptop with Google Docs open, and they recorded what was on the whiteboard and then distributed all the information to the group and to the tutor. When COVID came along, we knew that we could run CBL, the case-based learning, on Zoom, but we were really worried, particularly about the students that didn't have reliable internet access, as to what would happen, because we didn't want them to lose 4.5 hours of teaching each week. And that is where LT came into play for us. So the advantage for us was that there was already some courses in the Faculty of Health Sciences that were using LT, so there was experience around to help us. So it was a huge undertaking. There were 57 clinical cases that we had to copy into LT, and that's for 57 cases, but 3 to 4 sessions per week. So it was well over 300 hours of teaching that we had to really rapidly try and get online. And really, to be honest, we were only ever a couple of sessions ahead across the whole year. So it's a great relief that the teaching has finally finished. And so then we used LT in combination with Zoom sessions to run CBL. So this is just a really quick summary of how we went about this. So the PDF handouts here, we transferred into LT and we gave the patient an identity. We also, this is for first year students, gave a timer to give them an indication of how much time they should be spending on each page. And then below we provided tables and text boxes to make sure the students were covering what we wanted them to cover. The tutors were still present, but this way we were able to very much guide the learning of the students. And also, if we were worried that the students were going to cut corners, we could put in questions to consider to guide their learning further. Anatomy is huge in particularly Year 1 of the program. Normally there was someone on the whiteboard drawing all the anatomical diagrams, which depended on that student being really well prepared. We knew drawing wasn't going to work on Zoom with the facilities that we had or the students had. So what we did was we put images into LT, and then we provided tables for the students to complete themselves. And the upper limb case here on the right, this is one of the students' most challenging cases with anatomy. So you can see that we guided them, that instructing them, they needed to understand the muscle as well as the function that nerve innervated. I've just got a really brief video of the students using LT.
Also that she's in a rural hospital as well.
Really good pick, Jamie. What about rural hospital?
Well, some rural hospitals lack certain equipment and I guess things to treat people sometimes.
Yeah, very true. And any other systems that could cause severe abdo pain?
Because you have cardiovascular as well, like in an MI, you could get really upper epigastric pain.
Yeah, I like that.
It might be unlikely just because of her age, but still.
Have you guys
Congenital
seen?
urinary.
Yeah.
Plane. And the subcostal.
Oh, no, yeah.
The subcostal and transpyloric are both pointing to the same thing, aren't they?
Yeah, I'm confused.
They're different lines.
I think we just put it there. Yeah.
Jess, what do you mean by different lines?
Well, like there's two lines on the diagram, but they're
Mhm.
both pointing to the same one. So the transpyloric is the top one, which is that it's pointing to, and then the one underneath that is the subcostal plane.
Good. So as in, do you know what they cut through and what they look like on another image? So not on this one?
The subcostal is the bottom of the, like where the bottom edge of the ribs are.
Good.
And the transpyloric plane runs through the stomach, like the pylorus.
Cool.
Okay, so you can see from that video that using LT, we were able to continue to provide really rich discussion opportunities for the students. There have been a lot of advantages for us in transferring to LT. It's enabled us to provide excellent guidance to the students. And as I said, we can highlight areas that the students may previously have skipped, or areas that we know that the students have struggled with. We can provide more prompts around that. Another positive has been less reliance on tutors to cover all the material. Now, a lot of students have had problems in the past with tutor variability, so that has significantly reduced the effect of that. It's been faster to cover content such as anatomy. We're not waiting and dependent on the group member to be really well prepared and drawing. Also, it provided opportunity for us to do co-creation. So we have year 6 students that come to us for a medical education placement, and we were able to talk to them about remembering back to years 1 and 3 when they were having difficulties covering cases, what resources could they create to specifically target those areas. There has been a few disadvantages we found with using LT. However, some of that's been our user, I guess, learning experience, and particularly year 3 students were really hesitant with this new platform. Obviously, they've been doing it for 2 years already, so they were hesitant to take on something new, but we worked out that they just didn't want their hand held as much. So if we decreased the guidance to the students and made it much more like it used to be, then they were much more on board with using LT. We also felt for year 1, we were wanting to prompt them so much that sometimes it was adding too much content to the sessions. So we learnt to balance that and also create resources for after the session for them to use as revision. I was worried with anatomy that the students not drawing the images might decrease the learning opportunities, but you can see that the discussion was quite rich around that. So we're feeling better about that. Probably our biggest hurdle early on was mechanisms. So that's where we get the students to create a step flow chart to explain a physiological concept or even some pathophysiology. And the students find this really useful, and they used to do it on the whiteboard, and the mechanisms were huge. They found that really difficult using the LT capabilities. So they've actually gone to a third-party software platform such as Draw.io, and they've become really savvy at that. And actually, when I sat in on some sessions just last month, the students, even though they were in the tutorial room with the whiteboard, didn't want the whiteboard anymore and were just using Draw.io. So for us, it was very important to see that actually sometimes it's just a transition period. And if you hang tight, the students will actually get there and then end up preferring that. They love being neat notes. So really the lessons learned for us, the biggest lesson was that it's not a one size fits all for the CBL environment. So the year 1 students really responded to the structure very positively and have loved that extra guidance. The year 3s liked it to a degree, but they still want a lot more less structure so that they can have a broader discussion in their groups. We also very much learned that getting the students on board with LT came about greatly through using meeting the students every single week. So for that first 2 months, we met with the students for half an hour each week and worked out what worked really well in LT and what didn't work so well, so that then we could streamline the sessions. So for instance, when they're doing data significance, to have the table next to the information, they preferred much more as opposed to having to scroll up and down on the screen. So just really little tweaks made the students feel like they owned the sessions as well and had great response for us. So Liam, I think I'm cutting tight with time. There's enough time for just a couple of questions.
No, they're doing well. Yeah, so we've got about a minute and a half. I know, like, so bang, bang, bang. But yeah, we do have a couple of questions that just came in, so you should be able to see those if you want to answer them or attempt them.
There's one question where someone's asked me to email them about case-based learning versus problem-based learning. So I'm happy to do that. I'll copy the email address. How did we assess the group work individual contribution? That's a really good question. It used to be a tutor assessment, which we weren't happy to do when we went on to Zoom, because we knew, as I saw from the previous discussion, some students just sat back and were part of the ride and weren't actively involved. So we actually created data analysis questions, which were an online assessment where the students had a little bit of information about the patient, had to answer questions and then receive further information. We actually completed that assessment in Canvas, and that has been a really positive change this year for us as well. And so we're continuing on with that as well.
That might
Someone
be it.
has said they assign roles, leader, timekeeper, scribe, and rotate the roles. Yes, we also do that. We also initially, we were less strict about that early on because of all the changes occurring, but particularly the person recording the notes, it's a good indication as a tutor how well prepared they are if they're able to follow the discussion.
All right. Cheers, that's bang on time. Thanks, Andrea, for being the first one to do the, kind of hopefully not too time pressurous 10 minutes.
I'm glad I've run to time, Liam. Thank you very much for the opportunity today.
Yeah, no worries.
Thanks, Andrea.